Hi, my name is Daryl, and in this video I want to show you how you do the fee remission application late withdrawal due to special circumstances. So first you go on arcs.unimap and then you type fee remission. You search and the result will appear as, once it appears, you will see fee remission in special circumstances. You click on it and this page will open, and it gives you a list of instruction how you should do the application. So fee remission in special circumstances. Can I get my fees back or student contribution remitted if I withdrew late or fail is subject due to special circumstances? Of course, yes, it's possible. However, your application must be done within 12 months from the date of subject withdrawal, or if the subject was failed, within 12 months from the date of the study period in which the subject was undertaken. This means if you fail a subject in semester 2 2019, you still can do the application till now, like in December 2020. And if fee remission is granted for a failed subject, you will be considered for a grade change to withdrawn and advised accordingly of the outcome. This means if your WAM was based on the failed subject, the WAM will change, will not include the failed subject, and will only, like, the grade like failed next to the subject will change to WD, withdrawn. So how to become eligible for this application? You must satisfy those three criteria. The first, your circumstances must be beyond your control, in that they are not due to your action or inaction, either direct or indirect, or are unusual or uncommon or abnormal. This means it might be like a sudden panic attack or sudden health problem you could not control, make their full impact on and after the census date. So here it's really important that you, in your application, you demonstrate how your health, how your circumstance, your mental health issues or physical health issues started to influence your studies, your concentration after the census date. This is because they will ask you, why did you not drop the subject before the census date, so that you don't incur any financial penalty. And lastly, make it impractical for you to complete the subject requirement. So most of the time, students fail the exam hurdles. So even for a 30% exam, there might be a hurdles of 15% that you must get above that hurdles, that threshold to pass a subject. And in certain circumstances, you can also have hurdles over big assessment tasks. This means you need to get half of the marks for the assessment task so that you pass the subject. So your circumstances must have impacted you to the extent that you were unable to complete the subject requirements, and must have occurred or worsened on or after the census date. So the census date here is really important. All of the above criteria must have been met in order to apply. And then here it speaks about the application time limit. So you still have 12 months of subject withdrawal or subject you fail. This means if you withdrew a subject in the past after the census date and you get only 3/4 or half of the fees back, you can still do an application to get all the fees back, provided you can show how your health, how your situation forced you to withdraw the subject after the census date. And so this is another point. Say application submitted outside the 12-month limit will not be considered unless you can demonstrate with evidence that it was not possible for you to apply within this time frame. Being unaware of fee remission is not accepted as a reason for not applying within the application period. Information on fee remission is published on the university website. So they are really strict on this. You need to do your application within 12 months. You withdraw your subject after the census date, or you fail the subject. Application for a waiver of 12 months can be submitted via email to this. Then we have the supporting documents section. So the supporting documents is like mainly based on two, like here it's a fee remission special medical circumstances form that you need to fill in one page and have your practitioner complete 2 or 3 pages of this form. Your application will be deemed invalid if you do not attach this completed form as supporting documentation. And then you can have family reason and personal reasons. So I think they just introduced the counselor part because previous years they did not include the counselor. I think they included this part because of COVID-19 or the lockdown, stating the date your personal circumstance begin or change. Mainly the date is really important here because they want you to demonstrate how it changed after the census date, how your circumstances affected your ability to study. Sure, saying like, oh, the stress regarding somehow to a divorce or to an expected family death literally triggered some kind of emotional distress or like depression that you could not overcome, and thus was influencing your ability to study, to produce a quality work, doing like a good assessment task, like also affecting your exam preparation. And when it became apparent that you could not continue with your studies, so you also have to demonstrate this. So it's more about a writing skill. You need to prove your case. You need to show the date is important, the reason is important, the impact on your health, on your concentration, your ability to study is important, and you need to also like highlight, you need to also relate it to how this like influence your ability to produce a quality work for your assessment tasks, and also impacted your exam preparation that consequently made you fail the exam hurdles. So in terms of employment related reasons, so this thing I don't really know, so I never like explored this, but it's pretty clear. Course related reasons: a statement from a faculty stating that you have been disadvantaged by changing arrangement to your subject or course, and it was impossible for you to undertake alternative subject or courses. So it's more about the lockdown that prevented most students from like staying on campus. So this is saying, oh, if you had a problem like not accessing like certain software or certain like experiment you have to do as part of your subject that you did not do, you can still apply for some like for the fee remission, saying that you failed the subject because you did not have access to that specific resources. And this is actually new. They just introduced this year. It was not part of this form. In 2019, when I did my application, I remember they said only medical certificate will be accepted. And then you have how to apply. So how to apply, you actually have to go on a website. It's called Fee Remission. So first, how to apply. You need to print and complete the fee remission special medical circumstances form that you need to fill with a medical practitioner. Complete 2 pages of like and free of this form. So your application will be deemed valid if you do not blah blah blah. Then let's look at the form. Here's the form. The form is fee remission special circumstances medical circumstances, and you need to first put your name here, full name, like student number, date of birth, and list the subjects you enrolled. You enroll, study period, enroll, census date. Did you successfully complete the subject within the same period? Yes or no. Student signature, and then the second page and the third page will be filled by the your GP or counselor. So medical practitioner to be completed by medical practitioner. When providing details of a condition that occur prior to the date of consultation, please apply AMA and or equivalent guidelines. I have examined the patient face-to-face and certify that special circumstances impacted the above-named student to the extent that the student was unable to complete the requirements of the above-mentioned subjects. Yes. So please provide details of the special circumstance and in what manner they affected the students to complete the requirements of the subject. Please attach a separate page if required. So you need to be clear. You need to explain to your GP or to your counselor how to write this part. You need to ask them that. You need to say to them that, oh, you've been seeing them before the semester begins, before the census date, and then around week 4 when you started to have a lot of assessment, the stress building, and you felt very tired, overwhelmed by the load of work, and more importantly that the lockdown was also influencing your capacity to do the work properly. This means you were not able not only to do the work that you had to do, and you actually failed the task. So it's just need to really clear on that, how your health issues, for example, if you have a trauma related problem like PTSD, you need to clarify it and say to your counselor, say, oh, my flashback, my trauma got worse. I had more trouble sleeping during this time because of stress, and from week 4 to week 7, so you could not do the work, and the assessment tasks well, so you scored very low marks, you failed the hurdles for the assessment. And then you also have to mention for the exam, especially those who fail a subject, how your health issues in a way deteriorated as a result of the exam stress. So you could say, after SWOT-VAC, my health issues, mental health issues, worsened because it was very hard for me to prepare for the exam, because I had to submit a lot of assessment, and at the same time I had to prepare for the exam. It was my health got again bad, and I had to really do my best to not fail the subject. However, and unfortunately I still failed the subject because I could not do it. My health prevented me from even doing the task well. So you have to be clear when you ask your medical practitioner to write this statement, and also provide the impact this had on your exam performance during the exam itself. Say, due to a lack of exam preparation that I could not do, that was that happened as a result of my health issues, I could not do a proper exam. I could not write my answers properly, and this eventually made me fail the exam headers. You can also explain that the stress regarding your health issues make it impossible for you to focus in the examination hall itself despite having little exam preparation. Yeah, you can write anything, but you should be clear. You should detail if you experience pain in your tummy, if you have some kind of headache, or if you were facing some kind of dizziness, or you have seizures as a result of stress. You need to really highlight everything and detail it, so that the medical practitioner, the GP or counselor, can actually write about those things. And then please specify the date the student consulted you regarding the special circumstances. So you need to put the earlier you consult the medical practitioner, this means just 2 or 3 days after the exam, the better it is. the date the student's special circumstance began. So it could be an ongoing thing. For example, someone suffering with epilepsy, suffering from epilepsy might have different health issue here. So it's an ongoing one. The day the special circumstance impacted the student to the degree that the student was unable to continue studies and complete the subject requirements, you might say, oh, it's after the census date. Did the student consult you personally at the time of experiencing the special circumstances? Yes. You should say yes. You should say yes, or the person should say yes. If the student successfully completed other subjects during the same semester in which special circumstances impacted, please explain the reason the student was unable to complete the requirements for only the subject for which he is seeking fee remission. Here it's a trap question. It's telling you, for example, if you do like French subject which has no exam, French 5, against doing Calc 1 which has exam, they will ask you, why did you not fail French 1 but you actually fail Calculus 1? So you need to be in a way like creative or very strategic in your response. You need to know the difference between French 5 and Calc 1. French 5 had no exam. French 5 had only like ongoing assessment during the semester, and most of them were group tasks with no hurdles, unlike Calculus 1 where you had exam hurdles. So it was more likely that you were able to pass French 5 because there were no hurdle than Calc 1 where you had to prepare for your exam but you got a bad exam preparation. Consequently, you did not have enough time to prepare for your exam paper, and also during the exam itself, in the examination hall, you could not focus because of your health issues that was like influencing your capacity to concentrate, to focus, to write the correct answer. So you need to be creative, you need to know the difference. This question seems pretty dumb, but it's here to like in a way to discourage students from applying fee remission. And then we have fee remission special circumstance. So the guy needs to provide his professional name, signature, provide a stamp, provide the number. Make sure that all those details are true because this might delay your application. And the next thing we have after submitting this, you also have to submit the application. So you go back on the ARCS UNIMED page and you click submit a special fee application. And then this will open. Are you a former student or have recently withdrawn from your course? Please select yes or no. Yes, and you put your password and you log in. Once you log in, they will ask you to put, this is your name, it's my name ID. They will ask you to put your academic year. So you include your academic year. For example, for me, I failed a subject in 2019 for which I applied fee remission. So find subjects. In your case, you will have to put 2020. So for my Masters of Chemical Engineering, I had to withdraw the process equipment design subject that I took in semester 1 2019. So for my subject, I failed both the normal exam and the supplementary exam, but it was mostly because of an unexpected health issue that I was like encountering, and thanks to that thanks to this application, I managed to gain the money that I spent for this subject back. My grades was changed from like fail to withdrawal, and my WAMP also was like reset. It did not include the fail grades. And the subject, I redid the subject in semester 2 and I got like H1. So this is the application details. Sometimes you have to write a statement. Why are you applying for this like application. This is quite personal. You have to go and explain how your health issues were affected your exam preparation, prevented you from doing a good exam preparation, prevented you from focusing on the exam, or you could also say the stress. There are many other issues that you could include. You could also, I don't know if you can include technology, but yeah, but it would be, in this case, the Theorem Remission is mostly about health, about unexpected issues. And then you have to attach documents. So as part of this application, I showed you that they ask you to attach a fee remission special circumstances, medical circumstances like document. You also must attach like medical certificates. They ask your practitioner to give you like medical certificate like during the time you were not feeling well when you had to do the assessment, or simply like during the time you had to prepare for the exam, before pre-exam period, post-exam period. So as long as you can demonstrate that you have documents like after the census date, your application will go through. But make sure all the documents are present. So you submit some kind of like medical certificates, and then you have fee remission in special circumstances. Note that I don't think they accept health professional report form. It's called HPR form. That is usually used by counselors. I think they only accept medical certificate, or this new form they introduced this year, because at the time of my application last year I did not have this form to fill. So in this case you have to provide both like medical certificate and this form. But I strongly believe that they don't accept health professional form, HPR form. Yep. And I think that was all for this video. Thank you for watching this video and for joining the group. I hope this really helped you for your application. And please share this group with your friends and ask them to join so that they can also benefit from the advice and like tricks that I'm going to share in this group. Thank you. See you in the next video.